next we have Dr. Lauren Alberta-Wszolek. She is a dermatologist in Concord. She nearly needs no introduction, right? Because this is the talk we're really probably super excited to hear. She's also been named a top doc in Boston Magazine from 2020 through 2024. And so without further ado.
Thank you. Hi, everyone. Thank you so much. Okay. So, skin aging is the result of a combination of chronologic, genetic, hormonal, and environmental factors. So the goal of my talk tonight is to delve into both internal and external factors that contribute to aging skin. So internal factors, obviously hormones. We're going to talk about menopause and what it does to aging skin. We're going to talk about external factors. I wouldn't be a dermatologist if I didn't talk about the sun. So we're going to be talking about the sun and what it does to our skin. Then we're going to delve into anti-aging strategies. And I do want you to have some awareness about skin cancer because that can increase with aging as well. So internal factors, what happens to our skin with menopause? Now we have estrogen receptors all over our skin, particularly concentrated on our faces, our genitals, and the lower limbs. And these circulating estrogens and androgens bind to the skin for function. Now we know with menopause, obviously, this is associated with falling estrogen levels. So what does estrogen do in our skin? Estrogen helps to support the skin barrier. It helps with moisture content in the skin and hydration by binding to hyaluronic acid, thereby reducing water loss through the skin. Estrogen helps with maintaining collagen and elastin fiber production and formation in our skin. It helps with sebum or oil production, and it helps with maintenance of vascular tone. So what happens when we lose our estrogen with menopause? Well, our skin gets dry. Again, this is related to a weakened skin barrier. It's related to increase water loss and decrease oil production from our sebaceous glands. We know that dry skin can be itchy, so we see itching with aging. Our skin gets thinner and more atrophic. We see wrinkles and sagging. These are mainly related to that loss of collagen and elastin fibers within the dermis, which normally should help with structural support and elasticity. We have poor wound healing with aging, and also reduced vascular tone, which leads to flushing. And this is related to a reduced ability to regulate our temperature and blood flow, which contributes to hot flashes and a heightened sensitivity to heat. The image on the left, or your right, I should say, shows a reduction in your collagen and elastin in the deep dermis, and because you have loss of that supportive network, you'll see a deepening of wrinkles with aging. Within the first 5 years of menopause, our collagen levels decrease by 30%. So those are our internal factors. Now our external factors that contribute to aging, mainly sun, so UV radiation and also tanning beds. Now, I want you to know that UV radiation is present 365 days a year, so it does not matter if the day is cloudy or if it's cold or it's winter. UV radiation still comes through our ozone and is going to get to our bodies. So it's so important to wear that sunscreen every single day. It's okay to get 15 minutes a day, I give you that, but otherwise you should be put your sunscreen on in the morning and just have it on all day long so you don't have to think about it. So UVA basically causes DNA damage, and it can actually penetrate deep down into our skin, and it can just break up those collagen and elastin fibers within the dermis. So again, it leads to aging and wrinkles. Don't forget that UVA can actually penetrate through windows too. So even if you're in your car and driving, or if you're, working from home next to a window, you can get UVA coming through that glass, and it's going to cause aging. UVA actually causes a tan, okay? So that's what tanning beds are made out of, UVA light. UVB is different, so UVB does not penetrate as deeply as UVA, but it can still cause DNA mutations, and it can lead to burns. And we know that both UVA and UVB are important factors and can lead to skin cancer, but it can also lead to unwanted pigmentary changes like sunspots, melasma, as well as broken blood vessels in the skin. It's not only, again, sun as an external factor, but other things in our environments, pollution, nutrition, sleep, exercise, alcohol, smoking, and stress. All of this leads to, they play a role in healthy skin. It's not only our skin that changes with aging, though, but it's all these layers underneath the skin that, with normal aging, the fat changes, muscle and bone. Basically, fat can atrophy and redistribute with age, so the forehead and the cheeks tend to lose fat, as well as the, or I should say, fat pads kind of collect under the eyes, and they concentrate kind of on the lower face. And this is all related to gravity and a dropping of fat pads. Muscles tend to atrophy as well, and bone can kind of have recession and resorption as well as atrophy. So collectively, not just the skin, but all of these deeper tissue layers that contributes to an aging face. So what are the visible signs of aging? So the balance, proportion, and the symmetry of our faces change with age. The lower face shortens and widens. We get more prominent bony landmarks, as well as lines and wrinkles. We have a deepening of the nasolabial folds, more prominence of the transverse forehead lines. The 11s start coming out, a hollowing of the mid-face and temples, and the whole perioral area changes. So, women start getting the vertical lip lines. So many women ask me about that. Our lips thin out with aging and also, flatten. And the whole jawline changes too, again, because of all of the bony changes and dental changes that happen with aging too. So the whole jawline changes. You get development of the jowls and the marionette lines. Okay, so how can we think about what can we do for our skin to fight this? Take your notes. So number one, prevention is key, okay? The best products only work at undoing the damage. So most important, avoid the sun, avoid indoor tanning beds, and you should, try to be just cognizant of the sun at all times. So, if you're gonna be going to the beach, you can go to the beach, but, wear your hat, wear sunglasses, wear some protective clothing when outside, and try to seek the shade. Ooh, sorry. Again, you should be wearing a daily broad spectrum SPF of at least 30 or better every single day. 3 finger lengths of sunscreen, is adequate, and that should be what you apply every single day. For your face, your ears, you can rub it down your neck, and even the backs of your hands, because again, when you drive, you want to protect. Moisturizing regularly can be anti-aging because you're repairing that skin barrier, and you're recreating your barrier and locking in moisture. Exfoliating a couple times a week can absolutely help turn those skin cells over and help brighten and help aging. Using lukewarm water rather than hot water is generally less drying. Try to eat healthy, obviously, fruits, vegetables, omega-3s, healthy fats. don't smoke, drink plenty of water, try to limit alcohol, practice self-care, so try to get that sleep. I know it's hard with perimenopause and menopause, but try to get adequate sleep, 8 to 10 hours. It is true that sleeping with a silk pillowcase can help. With wrinkles, I should say. Try to get adequate exercise and try to reduce stress, obviously. Okay, what about products? So I'm even so confused by products, okay? But what can you look for when you're at CVS or Walgreens or Sephora? So, we are bombarded by products, and it's so difficult to compare one product to another because there's not good scientific data, okay? Things you can look for, though. Number one, a topical retinoid. So retinoids help increase cell turnover and stimulate collagen production to help wrinkles. Now, there are over-the-counter retinols widely available in many anti-aging regimens. These are usually about 1% or less, and generally these are weaker than prescription tretinoin. Prescription tretinoin is the only FDA-approved prescription topical anti-aging cream that can help treat wrinkles. And you can come see your dermatologist or, your primary care to get one of those. Number two, you can look for antioxidants. So these are usually in the form of serums. Antioxidants should be applied in the morning. So vitamin C, vitamin E, vitamin B3, like niacinamide. These basically help reverse previous sun damage. They can help soften fine lines, fade pigmentation, and they can have anti-inflammatory effects too. So really good thing to put on every morning. A lot of people ask me, how do you layer these things? Well, in the morning, put your serum on first, your vitamin C or antioxidant, and then you can put your sunscreen right on top, and then your moisturizer or makeup right on top. In general, like the thinner products go on first and then build after that. Number three, alpha hydroxy and beta hydroxy acids are awesome for aging skin. These are like generally exfoliating products, or they come as toners or cleansers or creams. But these can be used a couple times a week to help. So you should be looking for these are glycolic acids, lactic acid, salicylic acid, and they can help exfoliate, they can help unclog the pores, and also help pigmentation. They do help with acne too. I'm not going to get into acne, but they can absolutely help with acne, with hormonal acne. And number four, hyaluronic acid and ceramides. So as I mentioned earlier, we lose hyaluronic acid with estrogen loss. So by putting on hyaluronic acid, which is found in many moisturizers over the counter, this can again repair our skin barrier, hydrate, moisturize, and kind of give you a glow. Now remember, more expensive products are not necessarily better. Okay? And a healthy lifestyle and a consistent skincare routine is really important to kind of keep your skin hydrated, moisturized, and protected. Okay. So I wanted to bring this up because, again, we practice evidence-based medicine, and this is all over social media. So can we apply topical estrogen cream to our face for anti-aging? So currently, no menopausal hormone therapy is indicated to treat skin aging. And there's really very limited data on the use of hormone therapy and its effects on facial skin. We know for the most part that systemic forms of hormone therapy don't really have a significant impact on hydration and wrinkles. So what's happening is we know that vaginal estrogen cream can be used safely on the mucosal skin of the vagina to improve genital tissue without the risk of systemic side effects. So it's out there in social media that vaginal estrogen cream can be used on the face for anti-aging. And this has been looked at, okay? Studies have looked at this. Topical estrogen creams and topical isoflavones, so soy-based topicals, have been looked at for use by menopausal women, but in these studies, not necessarily on the face, but on other areas of the body, like the hips, the thighs. Not sure why they put them there, but they did not put them on the face. And the data is a little bit unclear. So, maybe there might have been an improved collagen and an elastic fiber content, maybe increased epidermal thickness, but it's really unclear, like, what's the clinical significance? Does it really help wrinkles? As far as we could tell from those studies, there were no serious side effects, no serious systemic adverse events of topical estrogen. And isoflavonoids, soy products, they may show promise, but the effects are still unclear. So my conclusion after reviewing all the literature is that, really more studies need to be done to evaluate the safety and efficacy of topical estrogen creams applied directly to our faces for facial rejuvenation. Topical estrogen cream applied to the face may be safe in limited quantities if, again, vaginal estrogen cream is safe on mucosa. So the thing about that is, mucosal skin is much thinner, and, systemic absorption of mucosal skin is higher. But I also think the vagina is much smaller than the face, and, I just think more studies need to be done, and, how much is safe? Because do you really not have systemic absorption, especially for our breast cancer survivors? Do you really not have systemic absorption if you're applying it over your whole face and neck and arms? And, we just need more data to safely, tell patients whether they can use this or not. And what about oral collagen? So this is all over social media too. I do think there's fairly good data that supplementation with oral collagen can help skin hydration and skin elasticity. It tends to show an improvement after about 2 to 3 months, but there does seem to be pretty good data for oral collagen. And it seems that marine collagens, so collagens derived from fish skin, may have the best results. Okay, so what if you're thinking about a little bit of extra help? So what are some cosmetic interventions? So, and I clearly made these slides before the election. So the goal is to restore a natural, more youthful appearance, correct for asymmetries, help soften, facial lines, reduce shadowing, and even out skin tone and texture. Everyone has an individualized treatment plan, and really the goal is not to look frozen, overfilled, fake. That's not our goal at all. So here I'm talking about facial resurfacing options, injectables, and surgery. So facial resurfacing options. Again, the goal is to help correct the signs of photoaging, like wrinkles, texture, uneven pigmentation, like those brown and red spots. And really, these are lasers that I'm talking about. There are so many lasers and light sources available, and really there's not enough time to talk about all the different laser options, but we have a wide variety that can help, again, stimulate collagen, help lines, help wrinkles, acne scarring. Lasers can help acne scarring, but also, pigmentation and vascular lesions. And we have lasers to treat all of that. Chemical peels can be used. So again, a wide variety of various acids, glycolic acid, trichloroacetic acid, sal acid. Chemical peels basically help exfoliate that skin surface. It can help brighten, it can help brown spots, and it can help texture. It doesn't really help that much for wrinkles, but it can basically help brighten and help texture. And then microneedling. So microneedling can be done, again, to help texture, acne scars. That's really it. Fine lines. So just a simple example of how lasers work in general. This is for wrinkles. Again, we have a variety of lasers. We have both non-ablative and ablative lasers, but essentially the mechanism is similar. These lasers can deliver columns of energy deep down into the skin to try to create a wound and try to stimulate collagen. So by creating an injury in the skin, you can stimulate wound repair mechanisms, and that helps build fibroblasts, which help build collagen. And with that, we can repair wrinkles and resurface the skin. So these are just some basic before and afters. The two on the left here for facial resurfacing for wrinkles, and the two on the right, lasers used for pigment and redness. All right, so now injectables. Here I'm talking about neurotoxins. So these are botulinum toxins, things like Botox, Dysport, Daxxify, Juvo, Xeomin. We have a whole bunch on the market. So these can be directly injected into the muscles of facial expression to basically help relax those muscles and help smooth out the lines. It helps smooth out dynamic wrinkles, so, our 11s, our forehead lines. Generally, the upper third of the face is the most common area to treat, but the jawline and the neck are other areas that we treat too, and chin. Just quickly, some before and afters. And, again, you don't have to look frozen. We can titrate, injections to give you a natural result. A lot of women want me to, with aging too, our eyelids sag. And so a lot of women we try to kind of lift the eyelids. But anyway, we can use Botox for different things. I also treat a lot of women too. Some of my patients with a prior history of Bell's palsy, and they may have lingering facial paralysis or asymmetry, so we try to correct for that. Okay, injectables, fillers. So fillers are products that basically help to revolumize the lower facial volume loss with age. So these can be injected to restore volume. So again, we typically treat cheeks, nasolabial folds, tear troughs, chin, temples, the marionette, and the jowl. Those are some areas. Lips too. Hyaluronic acid fillers are very common. These are mainly Restylane, Juvederm. They typically last about a year. But they improve volume and hydration. So these are hyaluronic acid fillers. So they help bind water and help replace the hyaluronic acid that we lose in our dermis. There's also collagen stimulators. So these are things like Sculptra and Radiesse. And these, when injected, they basically help to promote fibroblast activity and promote new collagen. So it's really, really trying to repair and restore that lost volume over time. Collagen stimulators tend to last also about 1 to 2 years. So here are some before and afters, so a nice improvement. And again, you don't have to look overfilled. I hate seeing some of the celebrities out there, it does not have to look fake and unnatural. Obviously, there's surgical options. I'm not a surgeon, but there's facelift, neck lift, liposuction, autologous fat transfer, blepharoplasty. Okay, so now I'm switching it up and we're going to talk about skin cancer, okay? Because skin cancers are very, much more common with aging as well. So what does skin cancer look like? It's so important to do self-skin exams and, get to know what your bodies look like. And you want to look for anything, new or changing or anything that looks different on your body, and monitor for suspicious lesions. Skin cancer can look very variable, and self-diagnosis can be unreliable. So the best way to tell if a growth you notice is skin cancer is obviously to come see us in dermatology. Skin cancer is very common, so 1 in 5 Americans will get skin cancer. The 3 most common skin cancers are number 1, basal cell, number 2, squamous cell. Those are collectively called non-melanoma skin cancers. So 1 in 5 Americans gets basically either basal cell or squamous cell. And then melanoma, which is also very common, is the 3rd most common skin cancer, and it's obviously the most deadly, so important to know what to look for. So basal cell skin cancer, this is the most common type of skin cancer that we see. About 80% of skin cancers usually happens on sun-exposed skin. Okay, so, the face, the ears, really anywhere, the arms, the legs. These tend to be more slow-growing, locally invasive, so they can grow locally within the skin, but they really do not metastasize or spread to internal organs. And there's a very high cure rate for treatment. So what to look for? You want to look for any new skin-colored pinkish red or pearly bump, a pimple or sore that doesn't want to heal, a reddish patch of skin, again, that doesn't want to heal, or an enlarging scar-like lesion. Squamous cell, the 2nd most common type of skin cancer, again, tends to happen on sun-exposed skin, very common on the legs in women. These can be a little bit more invasive than basal cell, but still very highly curable when detected early. So what to look for? A scaly or crusty, reddish bump or patch, a non-healing open sore, an unexplained persistent bug bite, or a warty growth that crusts and bleeds. I should mention too that not only does it happen on sun-exposed skin, but it can also happen on areas of prior scar. So if you have an old scar, even lichen sclerosis, which is a condition we usually see in the genital area, because that's a scarring condition, squames can happen in the genital area too. And then melanomas. So less common than the former 2, but it's only about 1% of skin cancers, but can cause a large majority of skin cancer death. Now melanomas can start anywhere on the skin, but in general in people with lighter skin color, they're more likely to start on the trunk, so the chest and back in men, but more common on the legs in women. The neck and face are other common sites. Acral melanomas, so those melanomas that start in the nails or on the hands and feet, are generally more common in darker skin types, but can happen in any skin type. And when detected early, most melanomas are completely treatable. So what to look for? A new spot on the skin or a spot that's changing in size, shape, or color. The ugly duckling sign, so anything that looks different from anything else. The ABCDEs of melanoma, and that's asymmetry, irregular border, color, so multiple colors or just something that looks different from anything else, diameter bigger than a pencil eraser, or E evolving or changing. Other warning signs, a sore that doesn't want to heal, or new itching, burning, or bleeding within a mole, or redness that expands beyond a mole. So in summary, skin aging is inevitable, and it's dependent on a variety of internal and external factors. Changes occur in all tissue layers, so skin, fat, muscle, and bone, which leads to fine lines, wrinkles, and volume loss. There are other changes in skin like pigmentation and blood vessels. But prevention is key, but treatments are available. So wear your sunscreen, practice sun-safe practices, and perform self-skin checks on yourself and your loved ones, and have knowledge about skin cancer, and seek out a dermatologist if you have any suspicious growths. Thank you.